Good afternoon, and welcome to Live Healthy Miami Gardens Facebook Live weekly series. The Live Healthy Miami Gardens Facebook Live is a weekly health and wellness series brought to you by the City of Miami Gardens Live Healthy Miami Gardens. Our goal is to bring our community information and resources to help us make the healthiest choice possible for ourselves as a Miami Gardens community and our families. My name is KeTia Harris. I'm Community Health Data Specialist at Jessie Trice Community Health System, Program Manager of our Breastfeeding Touchpoint Program based in Miami Gardens Clinic, member of Live Healthy Miami Gardens, and your host for today's Facebook Live segment. Live Healthy Miami Gardens was born from the realization that although health is largely influenced by our individual choices, the conditions in the communities where we live, learn, work, worship, and play are also major contributing factors to the racial and ethnic health disparities and health care disparities faced, as well as our overall ability to make healthier choices. We know that these conditions are systemic. We know that these conditions are historical. We know that these conditions still impact us as communities of color, as well as a whole here and now. Live Healthy Miami Gardens is a community initiative working to address these barriers in transformation of policies, of our built environment, and our healthcare system overall to make the city of Miami Gardens a healthier place to live, learn, work, worship, and play. Today's Facebook Live segment is on COVID-19 vaccinations and why people of color should get vaccinated. Our guest has served as a practicing physician for about 40 years, as well as a professor at University of Miami, Nova Southeastern University, and Florida International University. He's joining us today, offering his insight on the vaccines and to address our communities of color's concerns regarding the safety and effectiveness of these vaccines. Please welcome Dr. Mohsen Jaffer of UHI Community Care Clinic.
Hi, folks.
Hello, Dr. Jaffer. Thank you again for joining us. It's a pleasure to have you here today.
Indeed, it's a pleasure. It's a very vital topic. Thank you.
Is there any, I know I just shared some of your background. Is there anything else you would like to share with us today before we begin?
I practiced in Miami Shores, and there's a significant African-American community and the minorities. And I've experienced a lot with what's happened in the minority community, as I'm a minority. And I feel that this is a great stressful period in our society today. The COVID pandemic has really turned upside down so many of the things we took for granted. But what's coming out is the factor that the minority communities are not so healthy and are succumbing more to COVID. People are dying from the minorities from the COVID pandemic. And unfortunately, they are not getting the vaccines when they are available. So it's a triple tragedy, and we can discuss more on that.
Okay, I appreciate that. Thank you. What are the infection and mortality rates for Black and Hispanic populations in comparison to our white communities?
It is higher. I'm not familiar with the number, but it was much higher. In fact, there was NPR had a segment today on how much higher it is. But suffice it to say is that the healthcare in the minority communities has been of lower standard. You are all familiar with you're as healthy as the zip code you live in, because it's a mental attitude. Healthcare starts from childhood. You get your childhood vaccinations, you get your childhood doctor visits, and then slowly you become accustomed to going to a doctor, getting wellness care. And then if you have any medical problem as they are discovered as time goes by, you control them and keep them under check. Unfortunately, with the minority communities, this has not happened. Care has been very episodic and has been on just an emergency basis. God forbid something bad happened, you went to the emergency room, you were treated, and you were streeted. That's a loose term used, whether you get you out of my emergency room and treat you. But the follow-up care, the continued care, I'll give you an example. The low-hanging fruit in medicine today is high blood pressure. diabetes, high cholesterol, obesity. So many of these problems are easily corrected. Yet today, as a nation, we are only 60-70% effective. And if I have blood pressure, I have no symptoms, and somebody has to discover that by checking my blood pressure in a doctor's office or in a community clinic or in a health fair. And when they are discovered, I have to be convinced by that doctor or the health staff that it is so important I take treatment, because I'm taking it for a disease that I don't even have symptoms of. But if I don't take treatment for my high blood pressure, within 10, 20 years, I'll have kidney failure, heart attacks, strokes, and I'll be miserable for the rest of my life. A small problem that I cannot even feel, but left untreated, will cause tremendous harm to me and my society, because they'll lose me as a productive member of the society, and I'll become a cripple, and I'll become dependent on the healthcare system of the country. Yet today, we do not access this care. It applies to diabetes also and other simple medical problems that are so easily treated and kept under control. And this happens more in the poor zip codes. And it's because it's expensive to go to a doctor, it's expensive to get treatment, and it's time consuming, and it's a distraction. And it's not a priority, especially for these diseases that are asymptomatic. So it's very important that the project by Miami Gardens, Live Healthy project, is very near and dear to my heart, because this is so very important that we educate our population of becoming conscious of their body and their health and how valuable a gift it is. Everybody looks at their house or their car as a very valuable possession, but we forget that the most valuable possession we have is this body. And if it's not healthy, we age into a horrible life. And that's happening to the African American and Hispanic and the minority communities. We want to change that. We want to change that equation. And across America today, we need to start concentrating on wellness care and educating, especially the minorities, to become more of a custodian of their own health, to take charge of their own health, know their numbers, know their blood pressure, know their sugar numbers, know their cholesterol numbers, know their weight, the BMI, body mass index. We are getting chubby because we're eating fast foods. We're not eating right. Our nutrition is poor. We don't sleep well. You know, we are horrible today, especially in this well-connected era where you're 24/7, you are connected with the social media, your TV, your phone is keeping you awake. We're not sleeping enough, which is a big tragedy, because if you don't sleep 7 to 9 hours a day, you are causing your own body great and tremendous harm. So these are things we need to educate and send the message home. And this Miami Gardens initiative of Live Healthy is extremely important, and I hope people embrace it and tune in every time you have a show, because they can learn a lot and take charge of their own health. Because I truly believe that the best doctor you have is you. And let's educate our population to become the best doctors for themselves.
I really appreciate that, and I wholeheartedly agree, especially with taking control of our health. And the only way we can take control of our health, just like how you said, is to know what's going on with our health, knowing our numbers, knowing our status. I was laughing because I felt like it's telling on me a little bit because I do the same things. Don't get enough sleep at night, XYZ, and wonder why those things are going on, but not being, sometimes it's about not being proactive in that. And taking charge of my own health, although I do know better. But as far as our community as a whole, and I feel that it's important to also address this, especially when talking about taking control of our health, especially also getting this vaccine. What have you observed as contributing barriers to receiving the appropriate care in Black and Hispanic communities, or just in general communities of color? Would it be the lack of proactiveness, or could we also contribute it to fear and distrust in the healthcare system and providers?
True. It's all of the above. Like, first of all, to get an appointment today, you have to be tech savvy. You have to go and make an appointment online. So if you're not technologically very sophisticated to go online and log in and book an appointment, then you're left out. But more sinister than that is the disinformation that's going around in our society. Like, a lot of African Americans will tell you, oh, I'm not going to take the vaccine. This is another Tuskegee experiment on me again. You remember the Tuskegee inmates were tested with syphilis and so on without their knowledge. So it has been propagated that this vaccine is another experiment on the Black people, on the minorities. They feel it's going to sterilize me, or it's going to put a chip in my body, or it's going to change my DNA, or it's too new, I don't trust it anymore, I don't feel comfortable. Or Bill Gates and the rich people and the CDC are trying to dominate us by making it important and sterile and take over our minds and change our DNA. So there is so many things. It's got animal products, and these products are not clean, they're not kosher. All this social media is spewing this out, which is, I'm so sorry, this is such a disservice. I have taken the vaccine, so I'm preaching what I've practiced. I've taken the vaccine as far as it was available, because they gave us first. And I'm of the age where I qualified also. I'm above 65. But the beauty is that we have been working on vaccines for a long, long time. 100 years ago, we got the Spanish flu. It killed 50 million people worldwide. In America, it killed 5 million people. And it lasted 2 years. Today, we get the flu all the time. Every year, new strain of the flu virus comes. And it kills 25 to 35,000 people every year. We have treatment and we have vaccine. Yet, so many people die. Today, already, within 1 year, how many have died? Almost 600,000 people in America have died. And with no end in sight, because we have all to have herd immunity, or we are all vaccinated. And if we don't vaccinate soon enough, this is my greatest fear, that if we and the world is not vaccinated soon enough, the new variants will come about which are resistant to all the vaccines we have so far. This would be a great tragedy, a tremendous tragedy, because we will start all over again. Lockdowns will happen, our economies will go to the pot all over again, and we will be back to square one. So it is imperative that not only us, but the whole world gets vaccinated as soon as possible. So I would strongly urge all the people, especially the minorities, who are believing all this hocus pocus out there. Trust me, I got the vaccine, and I'm still here to testify that nothing bad happened to me. And remember, all medicines are poison. If you take a medicine, some people, very small number, will get side effects. Even if you take an aspirin, some people will get side effects and they'll get anaphylactic shock. They will start bleeding. They'll get an ulcer. So many bad things can happen. It's an ordinary aspirin. Okay? So there are some people who react to these vaccines. But if you look at the millions of vaccines given so far, the number of people who got any reaction is so minuscule that you don't even consider it significant. And if some people say the vaccine has come out too soon, we've been working on vaccines for a long time. Today, most of us have had polio vaccine, have had MMR vaccine, tetanus vaccine, and as time goes by, hepatitis vaccine, and we got Ebola, we got SARS, we got H1N1 that came out in the country and were devastating people. but we learned how to make vaccines faster. Before, it used to take 5 to 10 years to make a viable vaccine. But because today we were in such an emergency, before, like Ebola happened, it was contained in Africa. Containment only happens when people are not moving around too much, not flying all over the world. But this happened in China, and people were flying all over the world with coronavirus, and they spread it all around the world, and it went like wildfire everywhere. We should have not had it if our administration had been more vigilant and had controlled it better. We did more testing, we did more surveillance. We didn't do that. We failed. Okay, but that's water under the bridge. Today we have a vaccine which was invented and brought to production so fast. It's a miracle. To me, this is a modern marvel of science, how we learned to make this vaccine, and we now have proof that we have vaccinated millions and millions of people, and it is safe, and it is protecting us against COVID. If a vaccine is more than 50% effective by CDC and WHO standards, it's a good vaccine. These vaccines are protecting you almost to 90%. It's a great success. Please do not doubt the efficacy and the ability of this virus to protect you. Please, please, please get vaccinated.
Okay. And I was just about to ask, with all of that said, what will be our primary responsibility to overcoming these barriers? So number one is getting vaccinated. Are there any psychological barriers that you think that you would list as priority to taking control of our health? If there's one thing you can name.
That is a big barrier. Childhood, as we grow up, what did you hate about going to a doctor's office? It was getting a shot. Mm-hmm. Getting a shot is one of the greatest fears most people have. Even though the pain you get from the shot is so little, but just the psychological fear of somebody injecting with that steel needle into your arm is really very traumatic. And a lot of people carry that throughout their life. They fear. I know family members who, if you show them an injection, they panic. You see? So it is not wrong for you to be afraid. But you learn from other people. Today already over 100 million Americans have got vaccinated. Learn from them. Did they feel too much pain? Did they get very sick? Were they miserable for several days? No. The spectrum is from nothing to mild shoulder pain to maybe feeling a little sickish and feverish for a day or two. Some people feel even more sick, like a flu, but no more than that. Some people get diarrhea. Some people had reactions, but that is such a small number that I wouldn't even consider as a reaction because it's so minuscule. Okay? So this is the spectrum of what you may expect. But please, if you have the fear of injection, which is normal and understandable, you grew up with this trauma of injections as a child, you must overcome it and must decide that millions of my fellow Americans have got vaccine, 100 million plus have got this vaccine, and they've done well. In fact, when you go for a vaccination, they keep you for half an hour to make sure you're not getting any reaction, which is very good. Plus, they give you a paper, it's called very safe, so that you go on that website and you register yourself. You know, you just copy the QR code and you're on the site and you put your name down and the vaccine you had, and they call you they text you every day, and you sign and you fill in a follow-up form. Are you having fever? Are you feeling bad? Are you feeling this? All these questions. So every day they're following you. I had my vaccine in January. Up to now, they call me. Now they're calling me every 2 weeks, you see. Before it was every day. So they're following you and they're making sure you're okay. And if something bad happens, they will follow you and recommend treatment for you. So you have somebody helping you. There's a helping hand out there that, God forbid, you're one of the very, very few who has more than just a mild reaction. you have some help and ability to get help, to get treatment.
And I appreciate you addressing all of that, especially noting what our responsibility should be, and as communities of color. And also appreciate everything that Live Healthy Miami Gardens is doing with having professionals and experts like yourself come on and debunking some of the I don't say stigmas, but some of the myths and fears, and addressing a lot of the fears when it comes to getting COVID vaccine, vaccination. And I'm asking a question as representative of Healthy Miami Girls, but I'm also a skeptic myself. So with our responsibility as community of color, what would you, I guess, mention, or what would you state as our responsibility as healthcare and public health professionals in ensuring that our communities feel safe and secure and confident to get vaccinated?
I will give you a story. Okay. If you learn from this, you're a very wise person. I mean, I'm talking about to everybody. President of Tanzania did not believe in COVID. He thought COVID was hocus pocus, and he said, if you're a religious person, God will protect you. And he said you must take a lot of steam inhalation. He was buried 2 weeks back. He died of COVID. Many of his ministers died. Okay. Today, Tanzania has reversed the policies, and now they're going to vaccinate. He didn't order any vaccines. He did not believe the treatment, even though their ICUs are full of patients. They were not recording any cases. They were not telling the world. But the country learned. If the president of a country who is so powerful, surrounded by such powerful doctors and medical care, succumbed and died from COVID, who are we as ordinary citizens in this country who don't have all this ability of survival and medical care? Why would I not take this small help a COVID vaccine will give me and protect me from a horrible death or horrible consequences? All the people who get COVID, there is a wide spectrum. From no symptoms, 50% of the people will have no symptoms. So two of us, we get in a party, I have COVID and no symptom, I might give it to you because you don't know I'm having COVID. And you may, or my friend may have horrible results. I was asymptomatic, but I might give it to somebody who will get lung infections, horrible. You'll end up in ICU with clots in your heart, clots in your brain. A lot of people are recovering from COVID. I mean, a lot of people are dying. Okay? 600,000 have died in America. Millions have died world over. And then if you recover, there are millions and millions out there who can't think anymore. They have brain fog. They can't walk anymore because their heart attacks, they are like an old cripple. Some people are like crippled. Their kidneys have failed. So the COVID has gone, but has left behind horrible, horrible side effects. And they have to suffer that for the rest of their life. So if you respect your body and say, am I a smart person? Am I going to take chances and believe all this hocus pocus and not take the vaccine, but get COVID and God forbid have all these side effects and be miserable for the rest of my life if I'm lucky to survive? Or do I take a chance and take the vaccine and stay protected? I think it's an easy choice, but education is key. A lot of people don't have the answers. And I hope this program educates them to know that, look, you have people who have taken the vaccine, and you can see thousands and millions of Americans who have taken them, and they are okay. And learn from your fellow Americans and take the vaccine and protect yourself. Just be smart.
Thank you. As far as the virus itself, I know you addressed the increased risk that's on communities of color. With like the new variants of COVID, just new information we have on the virus itself, what changes, what are the what am I trying to ask? I apologize. What has changed with COVID-19 between, or what we know of COVID-19 between around this time last year and now?
You see, the first virus was found in Wuhan, China. That virus has mutated. What is mutation? You know, the virus, basically, it's a particle. It's not even a live, it's a particle. It lands on your nose or your mouth or your eye, the lining of your eye, and can get into your body. It takes over your cells. And then it takes the DNA of the cell and becomes a factory. And one virus particle might land inside your cell, and it'll produce 1,000 copies. And then that cell dies. And those 1,000 copies, just a number, goes and infects 1,000 other cells. Very soon your whole body is wrecked with the COVID virus, you see, and it takes over your body. So once you understand that this virus can do such bad things, by the way, every day when you eat, when you breathe air, you're taking in millions and millions of viri every day, okay? And your body overcomes them. Sometimes we meet a virus that we can't kill. Polio, Ebola, mumps, H1N1, and now COVID. This virus, we somehow are defeated. But billions of viruses we have met in our lives, we have defeated them. But this virus, not only is it stationary, stays the same like it was in Wuhan, China, it has mutated. So as it's producing more and more babies in your cells, its DNA is changing. So now the virus that first came out of Wuhan is not the same anymore. It is changing. In England, it became a new variant. In Brazil, it became another variant. Today, the worst variant is from South Africa. It is bad, and our vaccination is not as strong against the coronavirus of Wuhan as it is against the South African variant. And my worry and my fear is that we'll get a variant very soon that will be resistant to all our present vaccines. And that would be a horrible tragedy.
What are the vaccines that are currently available?
So there are about 19 vaccines available around the world. But what is approved in America, we have CDC, Center for Disease Control, which monitors all this, and they do a great job. CDC has been the leader in the world all these years, the leader in the world for fighting epidemics, fighting infections. They were the one who defeated Ebola in Africa and H1N1. We used to advise the whole world. We also formed WHO, and we were the primary movers and shakers of WHO. Unfortunately, for the last few years, we lost that leadership and we decided not to participate. But that's old story. Now, CDC is still our custodian when it comes to like viral diseases or new bacteria or new diseases. And CDC evaluates them and says, this is a new vaccine. How good is it? How effective it is? Give us your data. How many people you vaccinated? So what happens with the vaccine is, first, it is invented. Then it is tried on animals and so on. And then it's tried on a few hundred people to see, is it good for human beings? If it is successful there, then we do on a few thousand patients. And then finally, we have a phase 3 trial where we try it on thousands and thousands of patients. So the Pfizer vaccine, the Moderna vaccine, and the AstraZeneca vaccine has been tried on 50,000 or more patients, each one of them, and they came out with their data. So CDC looked at that data, and the first vaccine to be approved was the Pfizer vaccine, which was in conjunction with a company in Germany, BioNTech, and that vaccine was the first one. Then there was Moderna. These vaccines are mRNA vaccines, which produce a little note for you to take and your body to produce this spike protein in your body, which is the protein. If you look at the corona picture, all of you have seen it. They've got spikes on it, okay? So this spike protein, if your body produces antibodies and this virus comes in your body, immediately the antibody will go to the spikes and defeat the virus and kill it, okay? And then you have T cells, which are the killer cells, will come in and eat it up and destroy it. Our immune system is so wonderful. We must thank the Creator. Human body is a phenomenal machine. You must respect this body. Take good care of it. That's why Live Healthy Miami Gardens is a great initiative. But this teaches you respect for your immune system. The immune system is protecting you. So this spike protein is killed. So the Pfizer and the mRNA vaccine are the mRNA vaccines. But AstraZeneca took a vaccine from a chimpanzee and modified it and put this ability to come to our body and warn us how to produce antibodies against the spike protein. And all the other vaccines, the Chinese have got 5-6 vaccine, Russia has got a couple of vaccines, and India has produced a couple of vaccines. So a lot of vaccines are in production and are being used and have been tested. So my opinion is that if today there was no vaccine available and I had a Chinese vaccine or a Sputnik vaccine from Russia, I would take it. I'm that confident that these vaccines are doing well, because from WHO standards, they've crossed the basic threshold of being efficient and not harmful to you. But today in America, we have 3 vaccines, hopefully a 4th one, and Johnson & Johnson vaccine is approved. And AstraZeneca is still about to be approved, but soon will be. So we have 3 vaccines. The difference with the vaccine is that Moderna and Pfizer, you need 3 to 4 weeks to give a second shot for your immunity to come to par. First shot gives you some protection, but the second shot gives you the full potential of protection. Johnson & Johnson vaccine, which is now available, only 1 shot and it does the trick, which is very good. So hopefully AstraZeneca will come in, because our country has very smartly bought a large supply of vaccines. We have more vaccines coming to us than the population of America, which is very good, which is very wise, and I'm so glad. The only problem is we people of color are not going for the shots. So I was talking to the president of Broward College, and he said because of that, one college, the North Campus, you just show up, no appointment necessary. So if you can't get an appointment, and I believe in Miami-Dade College, the North Campus also, you just go, show up. And I know a lot of places, like so many parks, you just go and show up and you get your vaccine. But getting an appointment is good, because you got the right time, you get a shot, you're out within half an hour. I'm grateful to our nation, and the president now has given a lot of money to the states to make it available. The country has bought these vaccines and has given money to states to make it available to you, because there's a lot of logistics, storage. The Pfizer vaccine needs a very, very powerful freezer. Moderna also needs a freezer, but Johnson & Johnson doesn't need a freezer. Your refrigerator is good enough. AstraZeneca, your refrigerator is good enough. So those are the progress we are making. But yet the country has invested money, time, resources, and having mobilized FEMA to help us. We live in the greatest country in the world, a country that cares about us and is providing that vaccination. Can you imagine you were born in Tanzania, where your government doesn't even want to buy the vaccine, doesn't even want to recognize there is a COVID pandemic? We are so blessed. Please don't take your blessings for granted. Please, I beg you, get the vaccine. Any one of them.
Right. And what did you say the efficacy rate of these vaccines? You said the ones that are approved and available in the U.S. are at least 90% effective?
The Moderna and the Pfizer vaccine were tested when the pandemic was not so raging. And the Johnson & Johnson vaccine was tested later. And when so much happening with variants and so on. So their efficacy rate is 71. But I feel that if this vaccine had been tested at the time when Pfizer and Moderna was tested, their results probably would be in the 90% also.
That makes sense. With that said, with the level of immunity and protection offered with these vaccines, does that mean that upon getting the vaccine, we can, throw off our masks, party it up, be hugged up with the next, with our friends we haven't seen for months, almost like at least a year now? Or what are the precautions we should still be taking, regardless of if we got the vaccine or not? What are some of the precautions we should still be taking?
Unfortunately, I mean, how do I know if you tell me you had the vaccine? How do I know you really got the vaccine? There's no vaccine passport. There's a little paper they give you, a CDC form, but anybody can I guess, make it. I make a photocopy of it. Plus, let's look at the practical side. I could get the virus, and my body doesn't get infected, but I carry it because it carried in my nose and my mouth and so on. So every time I sneeze or I talk, I'm giving it to you. You are thinking, I'm vaccinated, so you're feeling safe with me. But I'm carrying the virus and giving it to you without me getting sick because I'm inoculated. So it would be a great public disservice for me not to wear my mask, even though I got my vaccination. Okay? Plus, this social distancing and so on, it's worked. Countries like Taiwan, South Korea, New Zealand, there is no COVID in New Zealand or in Australia. They tested people coming in and they quarantined well. They wore their masks. Today, they don't have infection, even though if you look at Taiwan and Korea, they're sitting next to China. They were some of the first countries to get the virus. Yet, the rate of infection and the number of cases are so low because they all wear a mask. There is a cultural acceptance of wearing a mask. Now, a lot of my fellow Americans says, I'm not going to wear a mask. It doesn't let me breathe. Oh, my oxygen supply is depleted. Unless I'm running a marathon, then I don't get enough oxygen with a mask. But, for normal living, you get plenty of oxygen. Doctors are doing surgical operations for 10, 12 hours a day wearing a mask. And the nurses are helping them. We're all wearing masks all day long. We have done it for hundreds of years, okay? So please do not poo-poo the mask. You get used to it. It isn't so bad. But everybody wears a mask. We would have had only 1/10 the number of cases we have had. 1/10 the number of deaths. Today, 600,000 people have died. If America had masked up from day one, would have not had even more than 50,000 cases. That's the estimate of CDC. Can you imagine what a disservice was this? 550,000 Americans died because we all did not wear our masks. So please, 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 do your service to yourself, to your loved ones, and to your friends and family and people around you. Wear a mask. Every time you're outside, wear a mask. If you're with your own family, fine, don't wear a mask at home. But please, when you go in groups and people are going out, meeting other people, you don't even know who has contacted COVID and they are asymptomatic for the next few days. They may get symptoms, may never get symptoms. So you don't know who's who. So we protect ourselves from everybody.
One final question, or next to the final question, is UHI Clinic offering any vaccines, or where can we find more information about vaccines and distribution?
You see, UHI Clinic, which is in Miami Gardens, is a completely free clinic. 12 years ago, we started this clinic to render care because America has got a lot of working poor. If you are very poor, you get Medicaid. If you are 65 and above, you get Medicare. You work for a good company, you get insurance. But a lot of our fellow Americans don't get care. So our clinic caters to them. And we've been doing testing and giving shots. And we're giving through a lot of community centers and churches and organizations and mosques and temples and so on. So our governor has opened up this. And today we're getting more and more community service organizations getting the shots. So I don't think there is dearth of ability to get a free testing done or to get your COVID vaccine easily. There is no excuse for you to feel that if somebody got COVID, go and get tested. Because if I got COVID, maybe only I got it. My wife and my children don't have it. And if I isolate myself, I'll protect my wife and my children. And I don't know who among them, because I'm so mildly symptomatic or zero symptomatic, but my wife or my child might die. So it's important for me to know the testing is very important. It was done in other countries which are successful today. Very, very active testing. And today, if you get a vaccine, my God, that's the greatest panacea. Get the vaccine so you're protected. I protect my family, my loved ones, my co-workers, my people I'm traveling on the bus or in the car or in restaurants. It is a great disservice for any American today not to get vaccinated. In the state of Florida, if you're above 18, you can go and get a shot today. Before, we only gave it to 65 and medical workers and then frontline workers, and then we brought it down to 50 and 40. But today, it's open for everybody. From April 5th, open to everybody. Today, we do not have an excuse. I don't care whether you're from a minority. I don't care what is your social status or how poor or unwealthy or disabled or what you are. If there's a catering for all of us. If you're disabled, they are catering for you. If you're a wheelchair, you can still get your shot. If you are homebound, you can still get CVS to come and give a shot at home. So we have got all this ability. Our country, our state is really going out of their way to protect us. Yet we are bogged down with this stupid ideas that the vaccine is bad for me. Please get over that. Believe us what we are saying and get your shot.
I appreciate that. And I just also want to remind our community that Jessie Trice Community Health System is still offering COVID vaccinations. Our number is 305-637-6400. You'll see that information, Jessie Trice information, and UHI Clinic's information in the ticker on the bottom. Thank you for joining us, Dr. Jaffer. Any final thoughts you'd like to share with our community? You already shared a lot of important, significant, profound information, but is there any other final thoughts you would like to share?
This pandemic also has brought out in us how important our immune system is. I went through scratched the surface of how our immune system works in protecting us. But the question arises also, how do you get your immune system up? And the best way to have a well-functioning immune system is to have a healthy body. That means start eating right. Start watching what you eat. Start exercising. All human body need exercise. I told you the best doctor you have is you. But who does the work in your body? It's your blood. That blood rushing around your body heals you, fixes you, and rejuvenates you. Okay? You buy a Cadillac 20 years ago, made of steel, is junk today. But your body can last 120 years because it constantly renews itself. So if you want to be renewed, you want to be healthy, and you want to have your immune system at peak, eat healthy, exercise, watch for the diseases. You might have the silent diseases, high blood pressure, diabetes, cholesterol, all these things. Get treated, stay treated. And ask questions to your doctor. Why should I take this? Why is it important that I continue? Because many times you will get tired of taking a medicine for a disease that gives you no symptoms. But once you are convinced, I'm doing myself a favor by keeping my blood pressure low so that 10 years from now, I don't get a heart attack or a stroke or kidney failure. Now you're a participant. You be a partner. We tell our patients, you are captain of the ship and you own the ship, but you need a navigator. Take a doctor as a navigator. Take our clinics, Jessie Trice or UHI Clinic. We'll treat you for free. We don't charge at all at UHI Clinic. Completely free. And you will get cheap medicines also because you can get generics, and you get very cheap tests also done. So our interest is to keep our community healthy and out of trouble. avail these opportunities that we are giving you, but you become the custodian of your health. You become the most powerful entity who controls your destiny, yourself, your body, your health, your wellness. And I'm grateful to Miami Gardens for taking this initiative and making us live healthy. God bless you all.
God bless you too. Thank you again for joining us, Dr. Jaffer. Thank you, community viewers, for joining us today. We'll see you next week, next Tuesday. We're here every Tuesday at 3:00 p.m. And have a great rest of your day. And again, live healthy, Miami Gardens. Thank you.